All right, good morning, everyone. Let's start by doing some more labelings from the study guide. If you could please pull up this picture, then we're gonna go ahead and label what we can. There are some old stuff that we already learned from last time, but there are some new things in the picture as well. Okay. So starting at the top here, we have the nasal cavity. Nasal cavity, which adds moisture, warmth, and it helps filter the air that we breathe. How about this structure right here? This whole area. What do we call that? Does anybody remember what that is called?
Pharynx?
That's right, that is the pharynx, the throat, right? Which is the common passageway for things that we inhale and for things that we ingest. Okay, so of course, we talk about how the air is going to go through the nasopharynx to enter the pharynx, whereas food is going to go through the oral pharynx to enter the pharynx. Okay. Over here, this is the larynx. And this here, that's the larynx. That is your where you will have your vocal cord, which vibrates and makes sound as air is passing through the vocal cords, right? And of course, the larynx is protected by different cartilage and bone structure, such as the thyroid cartilage, right? We talk about the cricoid cartilage and the hyoid bone. That was labeled elsewhere in the study guide. So be sure to check those out. I mean, you can't really see it. There's no label there here, but anybody know like what this thing is gonna be? What is this little structure right here?
Glottis?
That's the epiglottis, yes, epiglottis, which seals the lyrics, right? During swallowing. It's an elastic flap. We saw an X-ray video, right? Like what's going on when you swallow. Next we have this thing here. That is the trachea. They kind of opened this thing up, but the trachea actually has these rings on it, as you will see, that supports it and prevents it from collapsing. Right? Trachea. Which is like you see here, right? That's all the little ridges. But we're gonna go back to the PowerPoint slides later. I just wanna, kind of plan that in your head first. And we have lungs here. There are two lungs. We have one on each side. And on the right side here, this is going to have three lobes. Okay. There is these kind of groove, we call it fissure, and it like separates the lungs into different lobes. So this is right lung, and there is a superior lobe, middle lobe, and you probably guessed it, right? There is an inferior lobe as well. On the left side, the left lung, remember left and right are switched because we're looking at the person from the front, right? We only have two lobes. So just the superior lobe and the inferior lobe. The lungs are surrounded by a membrane, just like the heart is. And we'll talk more about this membrane later on, but there it is. It goes around it. It's also a double layer membrane, right? But collectively it's called a pleura. Double layer membrane that surrounds the lung. Okay, what about this this structure right here at the bottom? Anybody?
Diaphragm.
That is a diaphragm. Very good. Okay, so the diaphragm, as we'll see, moves up and down, and it helps us breathe. So that's it. Pretty straightforward.
So, Professor, the lyrics on the front side and the pharynx in the back side, or what is the difference in here?
It's not really front or back. It's just more like, how they try to fit everything together. But like the throw is at the back, right? The throw is at the back, but the lyrics is like the entire structure that's below the throw, right? So it's not so much at the front or at the back. Like if we look at it from the front like this, right? Like this whole thing is the lyrics, right?
Okay, thank you.
Like yeah, like the again the the whole thing. My tissue paper roll there. Okay. Is there another diagram? I think there is, right? Let me see. Yes. So here it
I
is.
have a
Let's
question.
go ahead. Yeah.
So you have the pleura and the pleurae. I missed if that one, if
Oh,
they were
sorry.
different.
I'm missing an e here. Yeah, yeah. So it's one of those plural singular thing, right? Pleura with an a, that's singular. Pleurae is the it's the plural. Yeah, it's like two layers, right? I just missed a e. Thank you for picking that up. Okay. Here's another picture. So this here, we have the lyrics, and specifically, this is covered by the thyroid cartilage, right? The Adam's apple, remember I talked about that? But then again, like female also have the thyroid cartilage, which is not as prominent, right? Okay. This here is another cartilage that supports the throat, supports the larynx. Okay, and that is the cricoid cartilage. And higher up there is another one, right? You might remember. I'm just gonna draw it here. We did it last time, okay? You just have to go through the, and there's some like other connective tissue here. There's a hyoid bone here. The hyoid bone is high up. That's how you can remember it. All right, moving down, we have the trachea again, right here. Okay, they are protected by cartilage. Cartilage rings. You can feel the rings if you move your hand gently up and down your neck, right? Press a little bit, squeeze a little bit, right? You can feel the ridges. Those are the cartilage protecting your trachea. Okay. So the trachea is actually going to split up and enters the lung. So let me just use a different color here. It's going to split up. So on the left side here, we have the left main bronchi. Bronchus, sorry, bronchus. Okay. Main, or sometimes called primary bronchus. And on the other side, we have the right main, and again, you can call it primary bronchus. Plural for bronchus is bronchi. Bronchi. It's like nucleus, nuclei, right? But it's weird. Like plural for octopus is octopuses, not like octopi. So I guess it depends on the context. Okay, sometimes you have to change the US to I, other times not so much. All right. The primary bronchus will continue to branch. It will further split. Right? So then here, you can probably guess this is going to be the secondary bronchus. And guess what? It's going to split again. And if you're thinking tertiary, then you're correct. Okay. So just keep on splitting and splitting, and eventually it will become quite small. Then we call them bronchioles. Okay. Plural. Singular is just bronchioles. But this is bronchioles. So typically very small in diameter. Right. So look, right? You're gonna have like your tertiary here. I'm just gonna use the same color. And then it's gonna become really small. It's gonna branch a couple more times. And when it's really, really small at the terminal end of these bronchioles, you're gonna have air sac. These air sac, they're called alveolus. Okay, plural again is alveoli. And this is the site of gas exchange. Okay, I'm just giving you an overview. We're gonna talk about all these again in the PowerPoint slides. And this just gives you a brief overlook as to what to expect. These things here, I think it's just asking for like the right lung and the left lung. Questions?
Sir, I have a question, but not about
Sure. Yeah.
this picture.
Yeah.
The online lab, right?
Mm-hmm.
I can't access it.
As in like you cannot see it, or
Yeah, I can't see it. When I click on it, it says end of lab.
when you click on it, it says end of lab. Oh,
Yeah.
let me see here. Okay. So homepage, anatomy. Anyone else having problem accessing it?
I just clicked it from this screen here. Please
I
continue.
also had the problem, Professor.
You also have the problem?
Excuse me, sir.
Yeah.
Like the lab assignment, is it the one we have to download? We need to turn in, or we still have to do the 2 attempts also? I don't understand.
Okay, so like this is the lab, right? Is this the one you guys are talking about, Patrice?
Yes.
And when you click on it, nothing happens.
No, it says end of lab.
Do you even see the PowerPoint at all or no?
No, no PowerPoint.
No PowerPoint? What did you say, Mohammed? Did you
It
say you have?
just says end of lab.
Mine is keep on circling.
Yes, okay. But did you like you see? Is this what you see, Patrice?
Yeah, it's the last.
Oh, okay, okay. So what happened is like I don't know, like maybe you scroll it through or something like that, and sometimes it just keeps on loading. It depends on your internet connection, but you can press on the download button. Do you see the download button, Patrice?
Yeah.
Yeah. So you just click download, and then it will go to your computer. Okay.
Okay. Is this a lab that's worth 2.5%?
This one is not worth anything. In fact, we're gonna take this up today. Okay. So this is the one I wanted you to do, on your own. And then the one that's worth 2.5% is the quiz, which is not, it's gonna be available later today. Okay. So you go to quizzes. Here, let me switch to student view. Assessment. I'll give you the link for it today, right? You click on quiz. And here are the self quizzes. But there's a lab quiz, right? That's the one that's 2.5%. That's the one, Tahib, that you can do 2 times if you want. But you cannot do this yet until you finish the PowerPoint slides, right? Otherwise, you will have no idea what the right answers are, right?
Okay, and this is due February 6th.
That's right, the day before the test. Okay.
That's the February 7th. Okay,
That's right, yeah.
I can look at that.
All right. So let me know if you still have trouble accessing it. But I think that's the problem. Okay.
I'm gonna try.
Okay, sure. So is this okay though? Like this diagram? Any question for it? All right. Let's go back to our PowerPoint then. There it is. So let's look at the lower respiratory tract. Remember everything above and including the lyrics, that's the upper respiratory tract. Everything below these deeper structure, that's going to be the lower respiratory tract. So here we have the trachea, which basically people call it the windpipe, right? Windpipe or airway, part of the airway is all the way deep down to the lungs. So, windpipe, I guess. It connects the larynx to the main bronchi, the left and the right bronchi, which, you saw connects to the lungs. It is anterior, which means in front of, and parallel to your esophagus. We labeled that last time already, right? When we do the head. And it's important to keep the trachea open because whenever we exhale, as you will see, the pressure actually drops in the airway. And anytime you have negative pressure like that, then things tends to close up. Okay. Imagine like sucking air out of a balloon. The balloon deflates, right? So we don't want the trachea to deflate. We want to keep it open. And that's why we have these C-shaped rings to prevent it from collapsing. Is C-shape because you don't want to restrict the esophagus behind it, right? So if you take a transverse section, a sideway cut, and you look at it, you can see the trachea is right here. That's the ring, the cartilage ring. Okay, this one probably didn't cut too well, but you know, it goes all the way there. And there is your esophagus. So two things to note here, right? The esophagus is actually much smaller compared to the trachea, and you know, they are in quite close proximity with each other as well. Okay. The inside of the trachea is lined with a layer of pseudostratified ciliated columna. Remember we learned about this like at the end of last course, right? When we do the different types of tissue. So pseudo, yeah, I did do it. Yeah, I did do it for your class because we ran out of time. But you know, for the rest of you who were with me, right, with the online session, we did it, right? So the pseudo, anybody remember what pseudo stratify means? Or you gave it all back to me, the whole course. That's all right. Stratify means multiple layers, right? Okay. And pseudo means fake. So even though they appear to be multiple layers, but it's actually just a single layer. Okay. So pseudo stratify means appears to be multiple layer. Multiple layers, but it's not. It's really just one layer. And they are ciliated columna. So columna means rectangular shape, and ciliated means they have cilia, right? So that's the kind of tissue that's inside the trachea. The cilia are there for obvious reason. We breathe in all these debris and, you know, dust particles, especially, you know, in the summer when there's like smog advisory and stuff like that. Like, you know, you blow your nose and it's black, right? So that's all these dust particle being trapped up. We need a way to clear it out of our system. That's what the cilia will do. And the cilia, of course, is part of your physical barrier, right? When it comes to innate defense. In addition to the cilia, there are also these cells called the goblet cells. Goblet cells. They keep on secreting mucus to coat the interior of the trachea to keep it moist. And it also helps trap some of these debris as well as a pathogen in some cases. And then the cilia will help get rid of them. Right? And when it comes up to your throat, you spit it out, you swallow it, right? So that's it.
Professor, what is the pseudo mean?
Pseudo means fake. Fake. Okay. Stratify means multiple layer.
Thank you.
Yeah. You heard of people say they have a pseudonym? Right? That's like a fake name, right? Pseudo. Fake.
Yeah.
All right, so that's what it looks like. This is just a cartoon picture. This is the real thing. And you can see over here, each cell kind of touch the bottom, right? It looks like you have multiple layers because the nucleides are kind of overlapping each other a little bit. It appears to be that way, but it's just a single layer. And every now and then you would have these goblet cells. Okay, goblet cells. And that's what they look like if you use a high power microscope to see them. All these other thing here that looks like, you know, carpet, those are the cilia. You might have seen this in movie or you might have heard about it. Sometimes when people have trauma in the face, for example, and there's a lot of blood pooling at the back of the throat, at the trachea, at the pharynx, sorry, then you cannot breathe through the nose and you cannot breathe through the mouth, and so they have to do a tracheostomy. Okay, they like poke a hole here and then insert a tube directly into the trachea. Okay, so then people is breathing through the hole here. They sometimes have to do this for people with throat cancer. And afterwards, what happens is when you talk, the air escape through the opening, through the hole, because sometimes the hole doesn't really close. And so when the person needs to talk, they need to cover the hole, right? Which makes sense because your larynx is up here, the vocal cord is here. If all the air is escaping here, then you cannot talk, right? Okay, because the air is not going through the vocal cords. Okay, so that's tracheostomy. Okay, so further down now, the trachea is gonna split into right and left primary or main bronchi. Each bronchus leads into the right and left lung. So as we label earlier, these are the bronchus, and then it goes into the lung, where it will continue to split, right? And inside the lungs, it will split into secondary, tertiary bronchi. Every time it splits, it gets smaller and smaller, right? It's kind of like an upside down tree, if you think about it. The larger bronchi are going to be supported by full cartilage rings. They're not C-shaped anymore because there's nothing behind them. Right? You don't need to leave a little gap to make space for something else. There's no esophagus behind it, so it's a full ring. However, when they get really small, then the rings become little bits and pieces, kind of like bathroom tiles. Okay, like the whole thing, just tiny chunk here, or think of them as like little puzzle pieces that attach onto the airway, right? Because it would be too restrictive to have a ring around the smaller airway. Essentially, the ring would be bulkier than the airway, and it's gonna be interfering with its function. But they still need support. That's why you have these bits and pieces of cartilage plates. Okay, so full ring here for the bigger ones, and then smaller bits and pieces as it goes further and further down. And by the time you get to the bronchioles, there are no more cartilage. The diameter is typically less than 1 millimeter. Right? 1 millimeter is like the distance between two black lines on your ruler, right? So they're really, really small. You can't put any cartilage on it. And on the inside, though, it still has the same kind of cells as the trachea. Right? Along the way, all the way down, right? From the trachea to the bronchi and then to the bronchioles, they all have these ciliated cells, and they all have these goblet cells. And because of a lack of cartilage, during an asthma attack, the bronchioles can actually collapse. Right? We call this bronchial constriction. Bronchial constriction. And the narrowing of the airway creates the wheezing. Right? When you try to force air through a narrow tube, there is this wheezing sound. And that's why the person needs to use the puffer, which causes bronchial dilation. It opens the airway up. Right? At the end of each bronchiole is a cluster of air pockets called alveoli. As I explained to you, the alveoli is where you will be doing the gas exchange. Okay. So this is a closer view, closer look at the alveoli. You can see the pulmonary artery takes the blood from the heart to the lungs. And when it gets to the lungs, it becomes like smaller pulmonary arteriole, and ultimately it becomes the capillary that surrounds these clusters of alveoli. The best way to think about this is those styrofoam net that sometimes comes with your fruits, right? When you buy fruit at the supermarket, there's a net that goes around them, right? So the net is like the capillaries, right? Surrounds the alveoli. And gas exchange happens using simple diffusion. The oxygen from the air will go into the blood, and then the carbon dioxide from the blood will go back into the air, and then you breathe it out. Okay. So that's what's happening in the alveoli. Now I have a small note I want to take with you. So please get some paper. Class notes. January 31st.
So Professor, those trachea rings are bones or muscles?
Sorry, what's that again?
The rings in trachea are bones or muscles?
Cartilage. Yeah. So cartilage is different from bones. They are like two different types of connective tissue. Like if you think about eating ribs, right? Like the bone is like the hard part you cannot break. The cartilage is like the white, crunchy, chewy stuff at the end.
Oh,
Yeah.
thank
The nose is made of cartilage, right? All right. So this note is about something called surfactant. All right, and surface tension. So two conditions needed for effective gas exchange. Right? When we try to exchange gas, namely oxygen and carbon dioxide with the environment, we generally need two conditions. Number one, large surface area. And number two, moist surface. So large surface area is okay because the alveoli, they are pretty much spherical in shape. If you do the math, sphere is the three-dimensional shape that has the optimal ratio between volume and surface area. Okay, meaning you can have the most volume. You can have the most surface area with the smallest volume, which is great if you want to pack a lot of area into your lungs, right? So spherical alveoli maximize surface area and minimize volume. Again, that means you can pack a lot of them inside the lungs. All right, moist surface is not too much of a problem for us. Our respiratory system is inside the body. It does not dry out. Okay, so two things, right? When it rains in the summer, after rain, and then you take a walk outside, what do you notice on the ground all the time? What kind of animals is like usually all over the ground? Do you guys know what I'm talking about?
Oh, the worms.
The worms, yeah. Why do they come out? Do you know?
They like the wet ground and stuff, right?
Actually, they don't like the wet ground. When they're in the soil, when it's raining, they are drowning. Because worm, they breathe through their skin. Okay. And it needs to be moist. But when it's pouring, it's actually filled with water and they cannot do the gas exchange. So they have to come out to breathe. Okay. But of course, afterwards, when the sun comes out, they don't make it back to the soil quick enough. And then they die because they dry out. When they dry out, they can't breathe, right? They need the skin to be moist to be able to breathe. Okay, so that's the reason. Another example is like fish. Okay, if you buy fish, fresh fish from the supermarket, Sure, sometimes they would scoop it out from the tank directly and give it to you, but sometimes they leave it on ice, right? Okay, and then you can see the fish kind of breathing, but they have to keep the gills wet and moist. Okay, so they like spray water on them. As long as it's moist, the fish can actually survive for quite some time out of the water. Okay, moist surface. So, what's the problem? Well, let's take a look at our alveoli. This is the alveoli. Alveolus, sorry, singular. It's really hard for me to keep track. Like English is not my first language, so all this weird plural stuff sometimes also gets me confused. So don't feel bad if you're like me. Now, the moist surface means there is a layer of H2O here, right? What's a property we learn about water like last semester, or you learn about it in chemistry when you draw the water molecule? How do we describe it? Starts with a P, the word I'm looking for.
Polar molecule?
They are polar, right? Exactly. Polar means they are attracted to each other, right? The oxygen is going to be attracted to the hydrogen. So if you have a bunch of water molecule, like a moist film of water inside the alveolus, they are gonna be attracting each other. Okay, so this blue force, that's the surface tension created by attraction between H2O. Okay, because they are polar. So what do you think that's gonna do to your alveolus? If the water is
Squeeze.
attracted. Sorry, what's that?
Squeeze?
That's right. Okay, it's gonna cause it to collapse, or it's gonna squeeze on it. Think of like a bag, and then you glue a magnet on the inside. It's just gonna collapse and close, right? Okay. So surface tension is going to close the alveolar. Okay, so I need you to think about this, huh? Is this helping you with breathing in, or is it helping you with breathing out?
Out.
Breathing out?
That's right. So this is helpful, I guess. Helps closest, sorry, helps in exhalation, but hinders inhalation, right? It's like the balloon. You blow air in, it takes effort because you got to break the elasticity, you got to break the stretchiness of the latex, right? Or the plastic. But when you let go of the balloon neck, air automatically comes out, right? Because the stretchiness kind of closes it, right? So same thing here. The surface tension is okay. It's gonna help by with the exhalation, with the breathing out. But when you try to breathe in, they kind of get in the way. Am I making sense here? Does anybody want to ask anything before I tell you the other force?
Not very good.
Okay. The rest of the class. Okay, great. Some of you have never spoken in all the times we spent together. Like if you bump into me on campus, I wouldn't even know who you are. But you probably would know me, right? Which is kind of scary thing. Anyways, so there is another force here called the okay, I'll draw it out first. So there are these cells. The cells are called like septal cells. Septal cells. And the septal cells secrete an oily substance that will break the surface tension? Because oil and water, right? Like they don't mix, right? Okay, this oily substance is called surfactant. There is no name for the force, okay? Technically, it's not really a force. It's more like it's just like breaking it. Okay. So this breaks the surface tension. It reduces the surface tension. So it helps open up the alveoli. Right? It helps in inhalation, but hinders exhalation. Okay. You don't want to have zero surface tension. That's actually bad because it makes breathing out difficult. There is a disease, there's a condition that we will learn later on today. It's called emphysema, where a person takes a lot of effort to breathe out. Okay. Regularly, the lung is like a balloon. Air should come out automatically. People with emphysema, it's like a paper bag. Okay, you blow air into the paper bag, air stays inside, right? It doesn't really want to come out. Okay, so it's not that surface tension is bad and surfactant is good. It's not like that. Okay? Think of them as two opposing forces that balances each other out. All right.
But Professor, if they balance each other out, the net result is zero. How the inhalation and exhalation?
Oh yeah, that's I think that I didn't phrase it properly. Like when I say balance, I don't mean they cancel completely. See, I didn't put X's on all of them, right? Okay, so like finding the right balance, as in like finding the right point where both inhalation and exhalation is relatively effortless, rather than one force dominating over the other. Okay. All right, back to here. So it turns out babies who are born prematurely, they have not had a chance to make the surfactant yet. Okay, the septal cells haven't fully developed, I suppose, and they're not really producing the surfactant. And when the baby is born without the surfactant, their alveoli is not opening up. Okay, because the surface tension is so great, it's like causes the alveoli to shrivel up, right? And it makes it very difficult for the baby to breathe. This is called infant respiratory distress syndrome. Right? So what happens is they have to inject a little bit of a steroid through the nose. Steroid is, as you know, oil-based. And as soon as it goes into lungs, it breaks the surface tension, it opens up the lungs, then the baby is going to be able to breathe. Okay. Sometimes if they anticipate the baby to be coming early, they might even inject the steroids in the mother, and that goes to the body. That goes to the baby, and it prevents these things from happening like immediately when the baby comes out. All right, so that's called infant respiratory distress syndrome. Okay, let's see. What do you think? All right, not bad. Most of you got it right. It is the bronchioles, bronchioles. They're not protected by cartilage. They're so small, right? That's why they can collapse during an asthma attack. All right,
But
the lung.
uh, and in the picture, the tertiary bronchi also does not have it. We can see only up to secondary.
Where is it? This one? No. See,
Yeah.
tertiary. Tertiary, they have the cartilage.
Okay.
Yeah, but it's like little bits and pieces of cartilage, right? As opposed to the whole thing. All right. The lungs are light and spongy. Each lung has some deep fissures. Fissures are just like grooves and lines, right? That separates them, and we already labeled it. On the diagram earlier, the right side have 3 lobes, superior, middle, and inferior. But the left one only has superior and inferior. And it kind of has a like a little indentation here to make room for the heart, right? Of course, the heart is slightly to the left in the body. All right, there's a lot of stuff here. I am just gonna draw it out for you. It will make so much more sense when you draw it out. Right. So here we go. This is the lung. I'm just gonna draw one side. Okay, lung. Remember, I said the lungs are surrounded by the pleura. Okay, and it has 2 layers to it. So I'm gonna draw that. It's really hard for me to draw it on the computer like this, but you know, hopefully you can do a better job. And this is not to scale, okay? Totally not to scale. And then there is another one out here. Okay, so together, that's the pleura. Now I want you to reach deep into your brain and think about what we learned in the first week. The heart also has 2 layers, right? What do we call the layer? As in like 2 layers of membrane that surrounds it. What's that?
Epicardium.
Okay, sort of, but I was thinking about the 2 membrane. There's one that's touching the organ, and then there's one that's outside. What is the one?
Endocardium.
Good try. Good try. Patrice, you were gonna say something? I saw you unmute briefly.
I was going to say the pericardium.
Yes, the pericardium, but then it has two parts to it, right? So the one that's touching the organ, that's visceral, huh? So visceral pleura. And we have the parietal. Parietal pleura.
So I have a question.
Yeah.
Since we're talking about respiration, what causes people to snore?
What causes people to snore? Oh, it's the relaxation of the pharynx, apparently. And you know, when they're in a relaxed state, it causes the airway to kind of change is structured a little bit. So when the air comes out, it vibrates, and it's the vibration that causes the snoring. People who snore a lot might have what's called sleep apnea. Have you heard of that before?
No.
No. So like they actually the snoring actually interrupts them so much that they wake up without realizing it. Okay, so like they sleep, but they feel super tired. Okay, because you know their body constantly wakes up due to the snoring, which in turns interrupt their breathing pattern. Okay, so they have to put a machine that applies positive pressure into their body, and that takes away the snoring. Yeah, and they are able to sleep through the night, and their spouse would be able to sleep through the night as well. Yeah.
So it can be bad and it cannot be bad.
Yeah. So, but sometimes people can, like, if it's really serious, they can do surgery of it. But most people go with the sleep apnea machine. I know it because my dad has one, yeah, it's life changing. If you guys want to look it up, it's apnea. sleep apnea. Apnea means can't breathe. Okay, so literally it means when you're sleeping you can't breathe, and the severe snoring sometimes is an indication of something like that. Okay, great. Where was I? So the visceral and the parietal, right? Remember I told you like it's like my you know, my inner shirt, that would be like the visceral, and then the outer shirt here, that's the parietal. And then we have a gap in between, right? So that's what this gap is. And just like you would guess, the gap is filled with some kind of lubricating substance, right? That is called the pleural fluid. Okay. So as the two layers of the pleurae rub against each other, because your lung is expanding, collapsing, expanding, collapsing, that rubbing is going to be creating friction. And we don't want friction. That's why there is the pleural fluid, okay, to reduce friction. Okay. Now there is some additional thing I want you to know here. It's a little bit hard for me to show you, but this here, this is your chest, right? And then down here, of course, as you know, that's the diaphragm. Okay. Yeah, let me do that again. The diaphragm. Okay. So I want you to understand that the parietal pleura, which is the one that's on the outside, right? Like the purple one here, parietal pleura, is going to be attached to the inside of your chest wall. Okay, that one is really hard to visualize. How do I explain this one on the, like, virtually to you? Like if you think about the chest, okay, like this is very graphic, but I'm sorry. Like if you open up the chest, right? Like open up the chest, like the inside of the chest. That's what I'm talking about. The inside of the chest. That is where the parietal pleura is going to be stuck to. Like if you ever see like a animal carcass, right, at the market, when they take out all the guts, right? Like I don't know, like some kind of animals, and then you can see the ribs inside like that, right? It's just hanging there. Okay? Like that's the inside that I'm talking about, and the parietal pleura is going to be stuck to that. That's important to visualize because it will help you understand how breathing occurs in a bit. That's the reason why I'm describing it to you. Okay. And at the bottom, same thing with the diaphragm. Okay? So what that means is, try to visualize this. When your chest moves out, right, it will pull the lungs with it. Okay? Same thing, when your diaphragm moves down, it will pull the lungs down with it. Okay?
I have a
Because,
question.
yeah, go ahead.
So is it stuck to the ribs or like I'm trying to
Yeah, I know. It's not to the, like, the bones of the ribs. Again, like I don't know. Not everybody eat meat. I understand that. But if you ever buy ribs and you prepare it, there's a film that is like connected to the inside of the ribs, right? Do you know what I'm talking about, medicine? Or no? That's not.
Okay, yeah, I got you.
Yeah, so
Okay.
like it's like attached to that, right? Because it's not just like bone and then lungs, right? There are other like connective tissue there, right?
Okay. And then it's like glue where it's like pulling it kind of.
Exactly. Okay.
Okay.
So I have another thing I need you guys to visualize here. Okay. Usually I would do a demo at school, but you know I obviously don't have the stuff at home. But imagine this with me. Yeah. Let's say I have like a plastic bag. Okay, a plastic bag on just on the table. Okay, like a small plastic bag, and then I have another plastic bag here. Okay, so go through this visual journey with me. Okay, plastic bag on the table, plastic bag in my hand. I put the plastic bag on top of the other plastic bag, and I try to lift it up. I'm not going to be able to pick up the plastic bag, right? That's like just common sense, right? Now, keep on visualizing this. Now I sprinkle some water on the plastic bag on the table, and then I have another plastic bag, I touch them, and now, am I going to be able to pick it up? Yes or no?
Yes.
Yes, because of the water, because of the surface tension, right? So, okay, when you breathe, when your chest goes out, it pulls the purple layer with it, but because of the pleural fluid, the red layer is pretty much stuck to the purple layer. So when it goes, it will pull it along. Same thing at the diaphragm. When the diaphragm goes down, the purple layer, the parietal pleura, since it's stuck to the diaphragm, is going to move down with it. And because of the pleural fluid, because of the surface tension, it will pull the red layer along with it. Okay? So the pleural fluid, not only does it reduce friction, okay, here I'll make another point. It also tethers the visceral. Tether means like connected to each other, right? Tethers the visceral pleura to the parietal pleura. In other words, when the purple layer moves, the red will move with it. Okay, so that's important. Later on, at the end, right, I will show you what happens when the two layers are no longer tethered, and that's possible. Okay, so like you will breathe, you try to breathe, but the lungs doesn't move, so you're not breathing, and obviously that's a dangerous situation, right? Any questions, comments, concern before I move on?
Yes, please.
Yeah, go ahead, BB.
I was just wondering, since like this movement, right, affects the visceral, well, how do you say that word?
Pleura, yeah,
Pleura
pleura, yeah.
as well. Is that the same, I guess, kind of thing that happens when you get like hiccups?
Oh no, hiccup is different.
Or-
Hiccup is just the involuntary contraction of the diaphragm. Okay, so your diaphragm is not listening; it's just like undergoing these spasms, and it pushes up on your abdominal cavity, and that forces air out. So that's what you have the hiccups. Yeah.
But Professor, is the chest does not move because of the movement of lungs, or chest moves by itself too?
Excellent question. That is what I'm gonna ask later on. Okay, and I'm gonna explain that. Very good, very good. Okay, it's coming. Okay. All right, so here is the picture. All right, like just try. I know it's really small, okay, but look, like this is where the ribs are, right? And then you have the parietal pleura that's attached to it. That's like the light pink here. You got the fluid right here in the middle. Why is the pen not going? Oh, there it is. That's the fluid. This lighter purple stuff, that's the visceral pleura, and then that's the lung, right? So it's like multiple layers, and you should really redraw it yourself to help you understand it. All right, so you can see that it's also connected to the diaphragm at the bottom, and then this is the rib cage. But you gotta understand this is like this is not a perfect illustration, right? This is like a two-dimensional picture, but like it's gonna go up to the front as well, right? Because your chest is just not just like on the side, right? It's like all the way to the front as well. Okay. So we're gonna talk about a few factors that affects airflow, and then we're gonna talk about we're gonna take a note on how breathing actually occurs. Okay. So factors affecting airflow. The physical movement of air into and out of the lungs depends on several things. Okay. Number one is called the Boyle's law. You will learn this in chemistry. Have you learned this in chemistry yet, actually? Do you guys do gas at the beginning or at the end?
Yeah.
You learned it already?
Yes.
Yes.
Okay,
In the
excellent.
last semester.
Oh, okay. So you guys know Boyle's law. Boyle's law states that there is an inverse relationship between pressure and volume at constant temperature. Okay. And in the body, the temperature is 37 degrees, so that's constant. And the inverse relationship means when you increase the volume, that's going to cause the pressure to drop. When you decrease the volume, you're going to increase the pressure. Okay. So by changing the volume, you can change the pressure. That's Boyle's law. Okay. Second factor that affects airflow is pressure gradient. When there is a difference between atmospheric and intrapulmonary pressure, then air flows from high pressure, high P, to low P. Atmospheric pressure, atmospheric just means like the surrounding area, surrounding atmosphere, right? That's why it's called atmospheric pressure. Depending on the like where you are relative to sea level, sometimes the pressure is higher, sometimes the pressure is lower. Okay, but like, you know, if you are just moving around in the same city, I guess, right, the pressure is always going to be the same. Okay. Intrapulmonary, intra is within, so this is pretty much like lung pressure. So we have two situations here. PA is bigger than PI. In this case, is the air coming into the lungs or is it leaving the lungs? Okay, PA is outside, PI is inside. So when the atmospheric pressure, what is it again?
Coming in.
That's right. When the pressure outside is higher than the inside, the air will come in. So this will inhale. On the other hand, if PA is less than PI, okay, if the pressure inside the lung is greater than the outside, then the air escapes, right? So this is exhale. Okay. That's why if you open a can of pop and you pour it into a cup, right, a glass, you can see the bubble coming out because the atmospheric pressure is lower than the pressure, right, in the drink, and then all these gas is escaping. They always go from high pressure to low pressure. Okay, same thing with those airs, what do you call them? The air freshener, right? Or the hairspray. When you press on the nozzle, you are releasing the pressure. It's very high pressure in the can, low pressure outside. As long as there is a passage for the gas to come out, it will come out, right? High P to low P. This is called pressure gradient.
Sir,
Yeah.
what does the PA specifically stands for?
PA is atmospheric pressure. Sorry. Yeah, atmospheric pressure
And the
is just
PI
pressure
is the
inside the lungs. Yeah.
inside the lung. Okay.
So there are two other factors. There's something called compliance. Compliance is the expandability of the lungs. If you think about a balloon has high compliance. That means it can easily expand. Something like a metal water bottle, low compliance. You try to blow air into it, you can't. Okay. It won't expand. It won't accommodate the air. So what determines the compliance of the lungs? Well, it's related to how much surfactant you have. Okay, remember, surfactant breaks the surface tension, allows the lung to expand, right? Okay, so you need to have some compliance. Right? We talk about the respiratory distress syndrome of premature baby, right? Low compliance in the lungs, can't breathe. Finally, there is a resistance to airflow, right, which is related to the diameter of airways. This one is very straightforward. If the airway is very small, then there's a lot of resistance. That's why you can't breathe when there is an asthmatic attack. The asthma causes the bronchioles to close, and the air is experiencing a lot of resistance. Even if, most of us don't really have experience with asthma attack, I hope. But think about when you have a stuffy nose, right? Can't breathe. That's what it is. All that mucus is blocking. Right? It's all accumulating in the airway. Makes it difficult to breathe. Okay. Let's take a early, yeah, exactly, right? The steroid is what's gonna be breaking the surface tension and also help open up the airway a little bit. And steroid is also like an anti-inflammatory properties, right? And during an asthma attack, there's a lot of inflammation that could be going on. So, the steroid kind of counteracts all those things. Yeah, thank you for sharing. Okay, so let's take an early break. We'll come back in, just come back in 5 minutes, I suppose, right? 43, okay? We'll do more then. Okay, see you soon. All right, let's talk about breathing, like exactly how it happens and all the moving parts related to it. And we're going to take a note here. We call this the mechanism of inhalation and exhalation. Inhalation is breathing in, exhalation is breathing out. So I want you to take a breath, okay? Just take a deep breath like that. And you feel the chest moves, right? So I want to ask you, did your chest move out first and then the air goes in? Or did the air goes in first? Did the air go in first and then your chest moves out to, accommodate the air? Is it like a balloon where you blow the air in and the balloon gets bigger? Or is it the other way around? The chest moves out and then air goes in. Let's try that again.
The other way around.
The air goes in first and then chest moves out.
Yeah, let's do
goes in first.
yeah, let's do a poll. Okay, I love doing this one. Okay, what happens first? Okay, A, if it's air in, chest out, or B, the other way around. Okay, chest out, then air in. Try it out. Okay, feel it. Okay, very good. Okay, I love it. Okay, I love it when most people get it wrong. That means I have something to teach you. Okay, I know it's hard to believe. All right, you're like, what do you mean? Like I go, see, totally, air goes in, chest goes out. I'm experiencing it. Okay, but actually, it's not. Actually, it's the other way around. Okay, actually, the chest, as you will see, hopefully, I'll be able to convince you. The chest needs to create the conditions that would allow breathing to occur. Okay, so let me write that down for you. Okay. The movement of the chest and the diaphragm create the condition necessary for breathing to occur. Okay. Shocking. So let's talk about inhalation first. Breathing in. Huh? Now I'm gonna draw some pictures. The pictures are again just exaggerations of what I'm trying to tell you. Okay, it's not to scale. You know, it's just trying to show to illustrate a point. Okay, so here we go. This is the person. When you need to breathe in, the chest is gonna move up. Okay, and the diaphragm is gonna go down. So chest moves out and up. And at the same time, the diaphragm contracts. Like when a muscle contracts, it means like it applies a force. Okay. So look, my fingers are relaxed, contract. Okay. Like think of the bicep. Okay. Like if you pick something heavy, it contracts, right? It creates a force, right? So the diaphragm is a muscle. It's a muscle that you can control. So it contracts and flattens while moving down. Okay. So these happen together, simultaneously happen together. Now remember, because of the pleura, right? Remember the purple and the red layers that I drew? The parietal pleura are stuck to the chest and stuck to the diaphragm. And when the diaphragm and the chest move, it pulls the pleura with it. Okay, pulls the purple layer, and then because of the fluid, the red layer will go with it, and so will the lung. So collectively, these actions will cause the lung to expand. Okay. So lung volume goes up. What happens to the pressure when volume goes up? According to Boyle's law, PI drops, right? We say lung pressure. Lung pressure drops. When PI, when the pressure inside the lung is lower than the atmospheric pressure, air enters lung. Okay. So the chest and the diaphragm, they have to move in order to lower the pressure. And then you will be able to breathe. Do you guys know the boa constrictor? It's like the snake, right? Like the really, really big one. Okay. I'm sure that's not what they look like, but anyway, the boa constrictor, how does it kill its prey? It wraps itself around the prey, like let's say like a small animal. It wraps around it. Okay. And so when the animal tries to breathe, it needs to expand the chest, right? But it can't because it's being wrapped around by this snake, right? Your chest literally cannot lift and move. And when you cannot move the chest, you cannot lower the lung pressure. Air cannot go in. That's how the animal suffocates. Okay. If you have something heavy on your chest, if something heavy on the chest, right? You also cannot breathe. Yeah, because you cannot lift the chest. Without lifting the chest, you can't change the pressure. You can't breathe. Any questions at all? All right. Now let's talk about exhalation. Exhalation is breathing out. So the opposite happens. Okay, opposite happens. Like you try to breathe the air out. Okay. So now, again, this is an exaggeration. The chest is gonna move in. And down. Okay, compressing your lungs now, right? And your diaphragm is gonna move up as well. Diaphragm relaxes and moves up. Resuming its dome shape. Okay. So look, this is your diaphragm. Okay. When you want to breathe in, it flattens. Inhale, exhale. And then, okay, breathe in, breathe out. Dome shape is relaxed, flatten is contract. Right, so that's gonna cause the lungs to decrease in volume and increase in pressure. So when PI is greater than PA, air leaves lungs. Okay. That's that. Any questions before I return to the PowerPoints?
It looks straightforward.
It looks what? Straightforward? Oh, okay. Yeah. Good. All right. More poll questions. Okay, visceral pleura is superficial to the parietal pleura. Superficial means on the outside, right? Things that are closer to the surface of the body, things that are closer to your skin, that's superficial, right? So this is actually not true. It's the other way around. The visceral is the one that's deeper, right? It's deeper. It's deeper than, okay, the parietal pleura. The trachea is posterior to the esophagus. Nope. The trachea is anterior. It's in front of your esophagus. The diaphragm is superior to the lungs. Also, nope. It is
Inferior.
inferior. It's below, right? The lungs are lateral to the heart. It's on the sides, right? The heart is in the middle. So that's the correct one.
Professor, I have a question.
Mhm.
Do you have any cheat sheet for all these like superior, inferior, posterior, and I know there was one lesson, like there was few diagrams in the last semester, but if
Yeah.
there's one sheet which has all of these things.
I don't have it, but if you go back to the last semester stuff, like here, maybe like this one, right? Yeah, that's the one with all the answers in it, right? Is that what you're looking for, or
Yes, I think
yeah,
yes.
okay.
Can I get a link of it or something?
Yeah, why don't you send me email and then I'll send it to you, okay?
Sure, thank you.
Yeah. If anyone else wants it as well, just
Yes,
email me.
please.
Okay, why don't I just post it online then? Yeah, I'll I'll just post it so I don't get flooded.
Thank you, Professor.
Yeah. Um, where was I? Right here.
That was the question in your final test as well.
Was it?
The hard one, the one before.
Oh, this one?
No, yeah, this one.
Oh yeah, I don't even remember. That's like a long time ago.
What is lung compliance?
Compliance. Anybody remember what compliance means? We talked about it earlier right before the break. There are 4 factors that affects movement of air. Anybody
Okay.
remember compliance?
Ability for lung to expand.
Exactly, right? Like a balloon versus the water bottle, right? Okay. Looks like we have a 4-way split here. Let's take a look. Increasing volume will increase pressure as well if temperature is constant. That is not true. Boyle's law states that increasing volume will decrease the pressure. Increasing lung compliance will make it easier to inhale. Compliance means expandability, right? And make it easier to inhale. If it's more expandable, then it's easier to inhale. That's true. Reducing airway diameter will lower resistance. If the airway is smaller, it's harder for air to pass through, right? So it will have higher resistance. Air will naturally flow from low pressure to high pressure. No, it's the other way around, from high to low. Okay. I am going to explain 2 things to you next. Okay, so we're going to talk about breathing at high altitude. So let's say like this. You are down here, let's say at sea level. And then this is up high in the mountains. Okay, this is high altitude. And I want you to think about this. Do you experience more pressure at sea level or at a high altitude?
At sea level.
More pressure, yeah, at sea level. Okay. Anyone else?
Sea level.
Yes, that's right. Because at sea level, you have all these air on top of you, right? Pushing you down on you, right? If you have a hard time visualizing this, think about swimming. Okay, think about swimming. Okay, if you dive down, you feel more pressure because of all the water on top of you, right? We are just adapted to live at sea level. That's why we don't really feel all this weight on us. But you know, the atmosphere is pressing down on us, right? Okay. So let's say we have PA here. PA, I'm totally making this up. These numbers are completely random. They don't mean anything, okay? But let's just say the pressure is 100. And you try to breathe in at sea level. What must happen to your lung pressure? Should it be higher than 100, equal to 100, less than 100? Let's do
Less
a
than
poll.
100.
Okay,
Less
sure.
than 100.
Less than 100, right? So this has to be, say, 60. Okay, so PI must be lower than PA in order to breathe in, right? In order to breathe in, you must have a lower pressure in the lungs than the atmosphere. Okay, so no problem. You expand your chest, you know, you lower your diaphragm, air comes in. All right, let's say you move up to the higher altitude now. So PA now, because there is less air on top of you, right? Compared to here, right? There's less atmosphere because you're higher up, just like swimming. So the PA is going to be less than 100, right? Let's say it's 70. Depending how high you go, right? The higher you go, the less atmosphere you have, right? Until you're like in space, there's no atmosphere, right? So in order for you to breathe, I need to lower my lung pressure. Okay? So I need to really stick my chest out, so to speak. But there is a limitation, right? Like we cannot expand our chest indefinitely. We're physically limited by, you know, say the rib cage and our body size and so on and so forth. So even if you try really, really hard, you might be able to drop the pressure further down to 50. Right? So look, the difference here is 40. And the difference here, triangle means difference, okay? Delta. This is only 20. So you are not able to drop the pressure significantly. You're not going to be able to make a significant difference with the surrounding environment, and as a result, it makes it more difficult for you to inhale. Until you are really high up in the mountain, we're talking about people who climb like Mount Everest, for example, they literally can't breathe. Even if they try, they can't, because the pressure is so low and the oxygen is very low in percentage as well. So even if you can get air into your lungs, there wouldn't be enough oxygen, right? So what do? They have to wear oxygen mask, right? They have to have an oxygen tank. And you hear so many stories about people climb up to Mount Everest, and they run out of oxygen. They don't have enough to come back down, and then they die, right? And you know, people can't even fly a helicopter up there to rescue them or anything like that, because the air is so thin that the helicopter won't fly. Okay, helicopter works by pushing the air down, and the air lifts it, right? Like Newton's third law. But if there's not enough atmosphere to press down, you literally can't fly up to help them. Okay, so that is why it's hard to breathe in high altitude. So if that's the case, how come we can breathe in an airplane? I mean, look, this is the mountain. Yeah, sure, it's high, but then like the airplane is like super high, like much higher. How come we can breathe in an airplane? No problem.
It's
They maintain the air
pressurized.
pressure inside the plane.
Yeah, both Madison and Mohammed got it right. The cabin is pressurized. Okay. I don't know if you heard, like a couple weeks ago, there was this news, right, saying like the emergency door like blew open or something, right, in one of the airlines, and then they have to ground all the planes. I forgot, was it like the 740 something? Anyway, you can look it up, and that's a really scary scene. But in that case, the cabinet would depressurize, right? Because now the air is leaking out. And sometimes in movies you've seen that, right? Like if there is a break in the airplane window or something like that, okay, maybe someone shoot it open or whatever, right? You see things being sucked out, right? They actually got that part right in the movies, because the pressure is so low outside, the cabinet is high pressure, and all these air is escaping. So that's why the mask will come down, right? The mask will have pressurized air, allows you to continue to breathe. Otherwise, you will suffocate and die. Okay. Any questions about this concept?
Sir, did you finish this note? What is the one for high altitude? How do we explain?
Oh, okay. Sorry, I was just mostly verbally explaining it. But basically, at high altitude, the difference between PA and PI is smaller, right? So two things here. Number one, not only is it more difficult to get air into your lungs, but when you do get air into the lungs, the concentration of oxygen is actually less, right? So these two things makes it really difficult to have good gas exchange. Okay. Just another quick note here. When you work in a hospital later on, I assume most of you are in this program because you want to become like practical nurses or nurses, which means you will likely work in a hospital sometime. There are these rooms called negative pressure room. Okay, so you will have a room, and then you will have the patient inside. Okay. And the room pressure here we call P1, and the pressure outside. So there's going to be like a machine there inside to make sure the pressure is lower in the room. Okay. So when you open the door to go in, and when you go in to check on the guy, okay, which way is the air going to flow? Out of the room or into the room?
Out.
Out of the room? Yeah. Anyone else?
No, sorry, inside, because P1 is less inside.
Yeah. Everybody understand what I'm trying to say here? Right? Because the room pressure is lower, right? So when you open the door, the air is gonna go in like that. Why? Why do we need to keep the person in a negative pressure room? Any suggestions, ideas?
Thinking something involving like respiratory viruses.
Very good. What about it?
You don't want them to like go around and get everyone sick, so you keep them in there.
That's right. So if there is some very contagious airborne infection that the person is having, right? We don't want it to spread all over the hospital. So when you open the room, the draft, right, like pushes all the air in and makes sure nothing escapes from the room, right? Of course, if you enter the room, you gotta, wear your PPE, right? Now there is also positive pressure room. Positive pressure room, which is exactly what it sounds like. It's gonna be the other way around. Okay, so this is P1 in the room, this is P2 outside, and then there is our patient. You open the door, right? This time, the air is gonna rush out. So who are we keeping in the positive pressure room and why? It has to do with something that we learned last lecture, in unit 3, I mean, lecture 3. Who do we keep in a positive pressure room?
I'll try maybe the people who have holes in their lungs and they're not able to expel the air once they breathe in.
Okay, good try, but not quite what I have in mind. Remember, it has to do with lecture 3. Lecture 3. What
Something with
concept?
immune system?
Say that one more time, please. Sorry.
Something with immune system?
Yeah, something to do with immune system. Who should we keep in a?
Bubble bowl.
That's right. If someone is immunocompromised, right, we want to keep them in a positive pressure room. So like, bad stuff's not gonna flow into the room, right? Does that make sense?
Yeah.
So when you do work in a hospital and you have a patient who is in a, negative or positive pressure room, don't leave the door open. Okay? It's you're gonna because if you leave the door open long enough, you're gonna equilibrate the pressure, right? And it defeats the purpose, right? So yeah. All right, let's move on. The urge to breathe. Right? So when you hold your breath, like if you take a deep breath and then you hold your breath, okay, you can hold it for how long? Okay, I don't know. Most people, if you're not training or if you're not like physically fit, maybe you can hold it for 30 seconds, right? Okay, 45 seconds, or if you're really good, maybe a minute. Okay, but there is going to be a point where you just have to give up. You just have to breathe. Okay? So the breathing center or the respiratory center, the same thing, is located in the medulla oblongata. Okay? And that's part of your brainstem. We'll learn about the medulla oblongata in greater detail when we get to the nervous system. Okay, but it's part of the brainstem, and your brainstem does a lot of automatic stuff for you, including breathing. Okay, so this medulla oblongata contains the respiratory center that is sensitive to carbon dioxide. Okay, many people have a misconception. They think you breathe because you don't have enough oxygen, but actually is carbon dioxide that is the main driver of breathing. Okay, so when you're holding your breath, you are not exhaling the carbon dioxide. That carbon dioxide builds up in the body, in the blood, and when it goes to the brainstem, goes to the medulla oblongata, it triggers your breathing center. It triggers your respiratory center, and then you have to breathe. Okay. Not only is it sensitive to carbon dioxide, it is also sensitive to H+. Okay, and here is why. I don't know if you learned this in chemistry yet, but can anybody tell me CO2 plus H2O, what does it produce?
CO2 plus H2O.
Yeah, what does it produce? Did you guys learn this in chem? I have no idea what you guys learn in chem anymore. H2CO3? Did you do this? Yes, no, maybe? Okay, this is carbonic acid, okay? Carbonic acid. And that's what happens. When you have a lot of carbon dioxide in the blood, it reacts with the water and it becomes H2CO3. And the H2CO3 is gonna dissociate to become H plus and hydrogen carbonate. Okay? So this hydrogen, if you have a lot of it in the blood, it makes your blood acidic, and it also tells the body you have way too much carbon dioxide in the body. So that's why it is sensitive to CO2 and H plus. Okay? So that will cause you to breathe, trigger the breathing reflex, and your respiratory rate might increase a little bit. This center is not directly affected by low oxygen. All right. So I want to also give you another quick description here. Okay, this is something you can try at home. Okay, but you know, if you have some kind of health condition, don't try this. If you're pregnant, don't try this. But if you're otherwise healthy, try this. Okay? So this is CO2 level in blood. This is time. Okay, there is a threshold level. This is the cap, the maximum amount of carbon dioxide that is in your blood before your respiratory center forces you to breathe. Okay. So, you know, if you're just breathing regularly, and at the end of your next breath, you hold your breath. You're like, oh, not breathing. Okay? So when you're not breathing, your carbon dioxide level starts to build up, right? But since before you hold your breath, you just exhale, so your carbon dioxide level in the blood is gonna start like somewhere low like this. Okay, and then it slowly builds up, slowly builds up, slowly builds up, and then you have no choice. You have to breathe. Okay. So this is how long you can hold your breath for. Breath holding time. Okay. So again, I don't know what it is for you. Like maybe 30 seconds, 45 seconds. You time it, you figure it out. Okay. And then this is how you can prolong that time. Okay. You can also you know, double it in some cases. All right. So this is what you do. You inhale deeply, and then you exhale deeply. Right, so you do that 10 times. And on the 10th time, when you inhale, you hold your breath, and then you start timing. You'll be amazed at how much longer you can hold your breath for after doing that deep breathing. Why does it work? Well, when you exhale deeply, you are breathing out extra carbon dioxide that you otherwise would not be doing with regular breathing pattern. Right? So that means you are starting at like way lower when you hold your breath. Right? So it takes a longer time for your body to reach the threshold. Right? So this is your new breath holding time. Okay. So that's a great way to, you know, make a bet with someone. Right? It's like, oh, I bet I can hold my breath for, you know, longer than you. But you got to understand, this is just tricking your mind, right? Tricking your brain, right? You are not actually getting extra oxygen by doing this, which is why it's dangerous to do it if you are trying to swim underwater, for example. Okay? People, if they do this hyper breathing, and then they try to swim underwater, to, you know, kids do this. They try to swim as far as they could before they pop out, right? But as you're swimming underwater, right, you are using oxygen that was not really there in the first place. Okay, you're just tricking your brain into not breathing. And so when you don't have enough oxygen going up to your brain, you pass out. And the first thing you do when you pass out is you breathe. But if you're underwater, you breathe in water and you could drown, right? Okay. So do you guys know like deep free divers? Free divers? These are people who train to dive without any kind of gears, okay? No breathing apparatus, and then they just go really, really deep. Like I recently watched like a Netflix documentary. It's about this lady who set multiple records, okay? There is so like this is the water surface, and then there's a line, and then you just go as deep as you can. And then you grab like there's a tag at the bottom of the line that shows you how deep you go, and then you come back up. Okay, and this whole time you don't have any breathing apparatus or anything like that, right? And so these people have to train to hold the breath and to kind of allow their body to use the oxygen in an efficient way, so that they don't black out. But it's a really scary documentary. I'll post the link. If you guys have Netflix, you can go watch it. You can see these people when they're trained. Sometimes they pass out in the middle of the water, like on the way up, and then people have to quickly move them to the surface, and you can see them. They're completely blacked out and lost consciousness. And it's interesting because you might be thinking, hey, how come they don't have like scuba divers like around, and if they pass out they can just give them the oxygen, right? It doesn't work that way, because when you're breathing scuba diver gas, the gas is pressurized, okay? But for these people, when they do free diving, they go down, their lung actually is really, really compressed because of the pressure from the surrounding water. And if you give them pressurized gas like that, it will literally cause the lungs to blow up. And so there's nobody can actually help them, right? The only thing you can do is just to help them surface quickly, and you try to resuscitate them by breathing into their mouth. And another thing about this is when you breathe into someone's mouth to if the person is not breathing, and then you do CPR, you try to breathe into their mouth, your breath actually contains carbon dioxide. And that's what's important. Yes, the person needs oxygen, but in order to restart the automatic breathing, you actually need to give them a bit of carbon dioxide, because the medulla oblongata is sensitive to carbon dioxide, right? So then, you're going to be able to trigger that autonomic breathing as well. Anyway, I went on a tangent, as always. So there are these things called the carotid bodies, which are found in the carotid arteries. Okay, you remember the carotid arteries from the first class, right? These takes oxygen to the brain, and the carotid arteries they contain these carotid bodies, and they are sensitive to oxygen concentration. Okay, in extreme cases where your brain, your medulla oblongata is not enough to trigger the breathing sufficiently, then the carotid body will kick in, and it kind of increases the urgency, the need to breathe. Okay? So voluntary control of breathing can only be suppressing breathing as long as you're conscious. But there's going to be a point where you don't have enough oxygen and you just pass out, and the body automatically will resume breathing. Okay, the picture here. There are a lot of stories where there are these really, I don't know what you call them, like really resilient kids, where they are like, I'm gonna hold my breath and not breathe if you don't give me chicken nuggets for dinner or something ridiculous, right? And then they would hold their breath, and then you sometimes would hear that the kids actually pass out because of that. And that's okay, because once they pass out, the breathing center is going to kick in, and they will automatically breathe again. Next, we're going to learn about the respiratory volumes. Okay, man, we're totally not going to have time to do the lab, take up the lab. We'll think about what to do about that. But we have to talk about a breathing respiratory volume here. And the best way to do that is actually to go back to our study guide. Okay, there's a graph somewhere. Is this VO2 max? Not quite the same thing, but it's related. It's related. That's the one, you know, you go on like a treadmill or something and they hook you up to a breathing machine, right? To check your breathing pattern and your oxygen content in the blood. But this is a little bit different. Okay, so that there is a graph here. Okay. So as we are breathing, our lungs is changing its volume, right? And there are different names associated with these volumes. Okay, so if we're just breathing in and out like regularly, like in and out, the lung expands, contract, expand, contract. That volume that's going up and down, right? This one here. So sorry. Oh, there we go. This volume is called tidal volume. Okay. I'm not gonna write the definition. The definition is all in the oh, is it in there? It's not in the PowerPoint, I guess. So I might have to I'm just gonna describe it to you, okay? Tidal volume. That's just the up and down fluctuation, like the tides come in and goes, it comes in and goes with normal breathing. Okay. This is normal breathing. Okay. And then I want you to try this. Okay? At the end of your regular inhalation, you continue to breathe in until you cannot anymore. So all the way until you cannot breathe in anymore. Okay? So that extra bit of air that you just inhale, that is called the inspiratory reserve volume. Inspiratory reserve volume. It's the extra bit of air that you can inhale beyond your regular breathing. Just stop me, yeah, if I'm not making sense to you. And the opposite is true. If you breathe out as much as you can, okay, until you can't breathe out anymore, all that stuff that came out, that's the expiratory reserve volume. I don't know why it's like written backwards, but really, these are volume of air that are reserved for you to breathe out. That's basically what it means, right? And these are volume of air that are reserved for you to take in should you need more air. So if you breathe out as much as you can, okay, at that point, you're right here. Your lung volume is right here. And from that point, if you breathe in as much as you can, all the way back up to the maximum point, okay, this whole thing is called a vital capacity. Okay, vital capacity equals to inspiratory reserve volume plus tidal volume plus expiratory reserve volume. Vital capacity. That represents the maximum volume of air that you can voluntarily move in and out of your system. And that is, limited by, things like the size of your chest. We cannot, keep on indefinitely expanding the chest, right? Okay. Same thing. We cannot indefinitely compress our chest. Okay. It's limited by the thoracic cavity, right? So I want you to think about this. When you are exercising, how will these things change? And just think about it. I'll explain in a second. Let's say you're running. Okay, think about how your breathing pattern changes and how will these volume be? Not so much faster or slower. I'm looking for like, do these volume increases or decreases? I
think
understand what you mean though, right? Like breathing
tidal
is gonna be
volume,
faster. Sorry, what?
tidal volume will increase.
Okay.
IRV and ERV will decrease, but the VC will remain the same.
That's right. Okay. So like when you are exercising, you're breathing not only more frequently, but you are breathing deeper as well, right? Okay. So the tidal volume is gonna increase. But when the tidal volume increases, right? Like, you know, think about the black lines you're going up and then this black line going down, right? And that's gonna take some of the volume away from the IRV and the ERV, right? Hold on a second. There we go. Oh, I erased everything. There we go. That's gonna decrease. Okay, but here, no change. Right? Think of the vital capacity as your monthly disposable income. Okay, let's say you have $1,000. Right, you're gonna split it into three things. Okay, rent, food, and transportation. If you spend more on rent, then you have less for the other two, right? And vice versa. So that's what this is. You have allocated more volume to tidal volume, to regular breathing, then you have less for IRV and ERV. Are we okay?
Yeah.
Okay. All right. Thank you. So, two more things here. When you breathe out as much as you can, okay, even after you exhale the ERV, the lung volume turns out to be not zero. You still have some air in there. Okay, this is called the, and I'm going to add another line here. Okay, I'll explain later. This is called the residual volume. Okay, this is air that does not leave the lungs. Okay, these are dead air. That's actually what they're called. Okay, dead air. They are high in CO2 and it does not participate in gas exchange. Okay, they just don't really come out. They are in the lungs. The only time the residual volume is going to come out is if you pop your lungs. Okay, that sounds unlikely, but you know it could happen. Right? Like a puncture wound, for example. Right? If someone is in a car accident, the impact can cause the rib to fracture, and then it could pop the lungs. So that's when the residual volume comes out, and even then, the volume is not zero. Right? There's still going to be some air in there, which is what this little bit here is called. That's called the minimal volume. Okay, so this is after lungs pop. It's like if I leave a balloon, like not the inflated one, just like a uninflated balloon on the table. There's still air in there, right? Okay. It's not zero. So that's that. Okay, so hopefully that makes sense. There is some like matching here that you can do with the definition. I encourage you to do that, and the answer is in the study guide answer. Okay. Let's go back to our PowerPoint here. There are some that we didn't talk about, like you just ignore those, okay? Just do the ones that we talked about and it's gonna be okay. Sorry, yeah, you were saying?
There was a second question there as well.
Yeah, we have not learned that yet. Okay, we gotta talk about emphysema first, and then we'll come back to it. Okay. Because of time, I'm just gonna tell you the answers. Okay, the amount of air that could be voluntarily expelled at the end of each respiratory cycle, that's the expiratory reserve volume. Okay, just write down the answer and then you can try them later. Okay, C. Oh yeah, we gotta do this. Okay, we should do this. There will be calculations on the test. So the vital capacity is 6,000. Tidal volume is 500. ERV is 1,000. Total lung capacity 7,000. What is IRV? So vital capacity is, as I told you, IRV plus tidal volume plus ERV. So 6,000 equals to, don't know, plus 500 plus 1,000. This is just useless stuff. Okay. So 500 plus 1,000 is 1,500. This is 6,000. And from your math class, you learn how to solve for unknown, right? So that's going to be 6,000 minus 1,500. That's the answer. Okay. Hey, so we're going to spend the last 20 minutes to talk about the effects of smoking and hopefully be able to wrap up the lecture. So smoking. Tobacco is the only legal consumer product that kills half of its regular users. Okay? That is crazy if you think about it. Right? It kills half of its regular users. If I sell you a vacuum and I say there's a 50% chance that using the vacuum is going to kill you, you will definitely not buy the vacuum, right? Yeah. But that's what this statistics is talking about. Okay? It's so lethal that it kills half of its regular user. Globally, cigarette smoking kills 4 million people each year, and about 70% of death occurs in developing countries, low-income countries. Non-smoker also dies of cancer and diseases brought on by breathing secondhand smoke. If you can smell it, then you're inhaling secondhand smoke. Okay? Which is why, you know, Ontario, they passed a law that ban smoking in the car if you have minors, right? And you can no longer smoke at a restaurant, okay? Because it's not only is it bad for other patrons because they're inhaling the secondhand smoke, but you know the waiter and the waitress, right? They also breathe it in. I have this friend in high school. You know, we would be waiting for our parents to pick us up. This was like grade 11, I think, grade 11, maybe grade 12. And then she'd be smoking. And then, you know, but when she sees her mom comes, she would quickly throw the smoke away. And then she would pull out this hairspray from her backpack and just spray it all over herself, right, to mask the smoke. And I was always like, you know, you can still actually smell it, right, even though you're trying to cover it up. But that's what it does, right? The smoke actually stay in the clothing, it stays in the furniture. So even after the person leaves, you know, and you can still breathe it in just from these residues that have collected on furniture and stuff like that. This map shows the prevalence of tobacco's use in male, okay, and you can see, you know, where it is of high use. And again, it's tend to be the darker the color, the more prevalence the use, and it's very similar for female. Okay, but overall, it's, you know, there are less female smoking compared to male. Okay, effects of smoking on the respiratory system. I will just go through it with you. I'm not gonna write the notes because we don't actually have time for that. But all the important stuff are on the slides anyways. So first of all, the cigarette has a lot of chemicals in it, right? And obviously these chemicals can build up over time in the lungs and causes mutations and irritations. And these in turns is going to increase the risk of getting infection as well as increasing the risk of developing certain kinds of cancer, right? And when a person smokes, there are all these tar that can build up on the lungs, and that's what these black things are, right? Which ultimately affects the functioning of the lungs. So that's like the obvious parts. Okay, I'll write something here. Build up of carcinogen, right? Chemicals and mutagen. Okay? Carcinogens are things that can cause cancer. Mutagens are things that can cause mutation. Mutation might not lead to cancer, but it will certainly increase the risk of doing that. Okay, so people switch to vaping now, right? Which is supposedly to be the healthier alternative. But I don't know if you guys read about this. Earlier on, when vaping first came out, there was a spike in scarring in the lungs because of how the vaping, I don't know what you call that thing, the device, I guess, how it vaporizes the stuff, it encase it in a particular oil droplet, and it turns out if you inhale that, it causes the lungs to become damaged. So, you know, sure, you're not breathing in all these carcinogens, chemicals, and stuff like that, but then, you know, you're causing lung damage in another manner. Another thing that smoking does is it will paralyze and eventually destroy cilia. Okay. So if you just smoke like once or twice, fine. I try it out, and then your cilia is gonna stop working a little bit, and then they will come back. Okay, they will start moving again. They will be okay. Okay? And then if it's continuous smoking, then it will completely destroy the cilia, and you left behind these basically scar tissue. Okay, and without the cilia, there is no effective way for your body to sweep up all those trapped particles, right? And you know, if you continue to smoke further, you are introducing even more irritants, right? And so all these things build up in the airway, and it increases the risk of getting infection. It increases the risk of getting asthma. Okay, and the only way for you to remove all this junk that's trapped up is to cough it up. Right, so people develop this smoker's cough. Okay, you just cough it out like that, right? And you spit out the stuff. Okay, so that is because of the cilia gone, replaced by scar tissue. Yeah, like a bald spot, exactly. Okay, quick story. Asbestos. If you have not heard of asbestos before, it is, well, that's what it looks like, okay? But asbestos is used as a fire retardant. Okay? And in a lot of older buildings, they have asbestos, you know, behind the walls. So in case
I have
there's
a question.
yeah.
Can a mother who smokes give birth to an asthmatic child?
Can a mother who smokes give? Okay.
Birth
I don't know if okay, so like if the mother smokes, you talking about like during the pregnancy or what? Like in the house or?
Well, and during pregnancy.
Yeah, so during pregnancy, I don't think it's gonna give the baby asthma, but then smoking during pregnancy has all other bad effects on the baby. Okay. Now, if the baby is born and someone is smoking in the house, then because the baby is breathing in the secondhand smoke, right? And as a result, they are going to be, also accumulating the irritants and all that, and that could increase the risk of getting not just asthma, but other respiratory diseases as well, right? Make sense?
Yes, thank you.
Is the effect the same of people smoking? What is that? Like through the bong, is it? I think that's what it's called, right? The like a pipe thing. I don't know. I didn't really look into it, but generally speaking, I would say smoking anything is not good. Okay, smoking anything is probably not good for your body. Okay, for various reasons. It's unnatural, right? Um, okay, so where was I? Asbestos. Asbestos is fire retardant. Okay, it's like slow the spread of fire supposedly, and it's in a lot of older buildings. Okay, and to get the asbestos, like there are people who have to mine it, I suppose. Right. So earlier in the days, the miners would be miners, like the people who go mine. Right. They get exposed to the asbestos, and it actually is a very potent carcinogen. Okay, it causes a very specific kind of lung cancer called mesothelioma. Okay, mesothelioma. And you only need a tiny bit of exposure. So the wives who did the laundry for their husbands, they weren't physically in the mine, but just by breathing in the residues from the clothing, they also got the mesothelioma, which is crazy, right? Okay. So nowadays, whenever they have to torn down old buildings, if they have to renovate or something, they really have to seal off the area, make sure that there's no escape of the asbestos into the air, because it's very dangerous stuff. Okay. So what does that have to do with what we're talking about? Well, there was this cigarette brand. Yeah, like when smoking was first, I don't know what's the right word, discovered, introduced, invented. Anyway, when smoking was first around, okay, people weren't exactly aware of its negative effect. It was like a social thing to do, okay, and people didn't really understand the negative health impact. Okay, and then later on, yeah, it was trendy, exactly, right? That's why, like, when you watch older movies, right, like the people are just smoking all over in the movie. It looks cool, right? I guess. And then later on, people start to understand that smoking is not good. Okay, the scientist starts to come up with data. The health practitioner, they're like, oh, smoking can cause all these things, right? So tobacco sales didn't want these kind of negative image to be associated with their product, because it means profit would go down, right? And so this particular brand, Kent, okay, I don't know, I never heard of it until I saw this story. They're like, hey, don't worry, guys, we got this figured out. Okay, we invented a microfilter. Okay, microfilter that is at the end of our cigarette. And you can see their advertisement here, right? All over America, more scientists and educators smoke Kent with micronite filter. This filter will filter out all the bad stuff, and you can smoke away and no problem. Okay. So guess what the filter contains? You probably know, right? It turns out the filter that they use actually contains asbestos. Okay. So the irony here is, okay, even if the filter does work, sure, you're not gonna get cancer from smoking, but you're definitely gonna get cancer from exposure to asbestos. Okay. So nowadays we live in a very different world, right? Like, yeah, if you ever see cigarette package, they have all these, cancer pictures on it, right? you know, with tumors, and then it shows how your teeth change. It's a way to try to make it look scary, right? I don't know if it's really doing a thing. Like if someone wants to smoke, they're not gonna, you know, get deterred by, you know, a few pictures here. And now the government even tried I think it's a new thing in Canada, right? Like last year, late last year, they are printing individual labels on the individual cigarettes. I think it says like poison or something on it, and it's all part of trying to get people not to smoke. Personally, I think, you know, government is never really gonna, you know, do too much to try to dampen it because it's revenue stream for them, right? They actually make a lot of revenue from you know, taxing the tobacco. Anyway, that's just my opinion. Moving on. Another thing is emphysema. Okay, emphysema. You've seen this word coming up, came out a few times, right? So emphysema occurs when alveoli are destroyed. Okay, and I'm not saying it only happens to smoker, okay, but it definitely can happen in smokers. And when they're destroyed, okay, remember we drew the alveoli, they were like little balloons, and the surface tension caused them to squeeze, right? And helps you breathe out. When your alveoli are all destroyed, you lost the elasticity. Loss of elasticity in lungs. Okay, so exhalation becomes difficult. Okay, not only that, because you have all these big empty space now. Okay, you are increasing the residual volume. Okay, you have more dead air in the lungs. You can't breathe out all of it because your lung doesn't have as much elasticity, right? You're not squeezing out as much air. So you have more dead air in the lungs, and it basically reduces gas exchange efficiency. Can you visualize that? So dead air is basically like, you know, if you think about a tube here, right? Okay. Like this is the dead air that doesn't come in. You're always just taking the top tier out, you know, maybe 90%, and you exchange it. And that 10% is always just stagnant. All right. But then in emphysema, right, you have more dead air. So you're only exchanging like 70%. It doesn't sound like a lot, but you know, it actually reduces. Yeah, you cannot solve it, unfortunately. A great question. Okay, so this is irreversible. In fact, if a person has emphysema plus chronic bronchitis, bronchitis is inflammation of the bronchi, right? And this is often the case for long-term smokers. Why? Because the cilia are gone, right? And all this scar tissue and all this irritant coming in is going to cause it to become inflamed. When a person has emphysema and chronic bronchitis, we call that condition COPD. You might have seen people, again, in movies or like in real life, that they have to carry an oxygen tank around in order to breathe, right? They have COPD. It's so hard to do gas exchange that they cannot do it on their own. They have to breathe oxygen, higher than normal oxygen content. Again, I'm not saying everybody who has COPD is because they are a smoker. That's not what I'm saying at all. There are other causes of COPD. But long-term smokers, they are more likely to develop COPD. Okay? All right, enough about smoking. Let's talk about other things that are also kind of scary, but could happen. pneumothorax. Pneumothorax. This is where the lungs collapse due to a puncture in the chest wall. Okay? And that could cause by things like knife wound. Okay. Hopefully this never happens to anyone or will not happen. But it's not just knife. I told you, car accident can be very impactful, that it causes the rib to break and puncture the lungs. That's possible as well. And the collapse can actually happen spontaneously. Okay, usually it's caused by rupture of small cysts. If you don't know what a cyst is, these are things that could grow anywhere in the body. Sometimes they grow on lungs, sometimes they grow on ovaries, okay, kidneys, yeah, and it's really scary. This is true, okay? This is 100% true. The cyst can contain weird things in it. Things like hair, right? Most of the time it's just fluid, okay? But sometimes they could have hair, they can even have tooth growing in them. And it's just really, really, scary things. And one of the things that can happen is they could pop on their own. Sometimes if they pop on the surface of the lungs, that could create so much force that would cause the lungs to collapse. Okay, so you can see in this X-ray, this is collapsed, right? Fortunately, only one side collapsed, so you can still breathe with the other side. But when the lung collapsed, right, when there's the puncture wound, you basically destroy that tethering that I was talking about. You know, the pleura, right, the purple layer and the red layer. If the lung is punctured, then the fluid is kind of leaking and it's not glued together anymore. So your chest moves, you try to pull the lungs with it, but the lungs won't go. Right? So the chest and the diaphragm is trying to increase the lung volume, but without the tethering, the lungs are not moving with it. So you can't breathe. Right? So how do you fix that? You gotta insert a tube. I can't find a better picture. Okay, if you find a nicer one on Google, please email it to me. You insert a tube through the hole, and you're gonna pump up the lungs basically. Okay, so after you pump up the lungs, you're gonna patch it up. You create like a one-way valve, so the lungs is gonna stay inflamed, and then time will heal the puncture, right? Yeah. So symptoms include sudden onsets of chest pain and shortness of breath. I had a friend, two people that I know actually. They both had pneumothorax, not because of lung puncture, but just like spontaneously it happens. They never told me whether it was a cyst or not. Okay, but they said it was a very painful experience, and both of them are teachers. So I don't know if it has to do with talking too much. Always in the back of my mind, I always worry a little bit that it's going to happen to me one day. All right, is this the last slide? I'm so sorry. There's so many things. Carbon monoxide poisoning. Carbon monoxide is a colorless, odorless, tasteless, poisonous gas. You cannot detect it with your senses. That's why it's so dangerous. Okay, and carbon monoxide is generated when there is incomplete combustion. Do you guys learn about combustion in chemistry, right? I think by this point, right? Where, you have, yeah, great. A fuel reacting with oxygen, producing carbon dioxide, water, right? In an incomplete combustion reaction, where there is not sufficient supply of oxygen, okay, where oxygen is a limiting reactant, then you will generate carbon monoxide in addition to carbon dioxide and water. Okay, so a car engine has incomplete combustion. That's why you should never sleep in your car with your engine running. Okay, I remember growing up as a kid. There was this commercial that I see on the all the time, that people turn on their AC and then they sleep in the car because it was so hot, right? And then people would come knocking and try to wake them up and tell them, no, don't do this. This is gonna kill you. Okay? Because when the car is not moving, all that carbon monoxide from the exhaust can start seeping in back into the car, and it could kill you. Okay, what about in the house, within the house? If you live in a house, what might be a possible source of carbon monoxide?
Furnace?
The furnace, that's right. Not so much the AC. AC is for the most part outside of the house, and it works very differently. But your furnace right? It heats up the natural gas to create the warmth, right? And you know, when it's functioning properly, no problem. But when there is some kind of like an error or malfunction to it, then it could start to produce carbon monoxide. And again, we cannot detect it anyway, right? That's why we have to have a carbon monoxide detector. If you have one, you should put it where you sleep. Okay, don't put it in the kitchen like many people do, because when you cooking, the cooking fumes can actually interfere with how it works, and then it ends up not working. Okay, so have a carbon monoxide detector that wakes you up when there is carbon monoxide, right? Oh, okay. Another thing is I think this was like many years ago, like 6-7 years ago, there was this big blackout in Toronto, which you might remember. It was the middle of the winter, and it was blackout for 2-3 days, I think, at the time, and it was really cold, and people were bringing their like propane heater into the house to try to warm it up, right? And again, that is dangerous because in the house there's not enough oxygen to sustain that kind of ongoing burning, and it generates carbon dioxide. And if you sleep next to one of these things, it could kill you, right? So yeah, don't do it. Okay, just wear more clothes. So after talking about all this, I still haven't tell you why carbon monoxide is poisonous. The problem has to do with hemoglobin. The hemoglobin is the molecule that transports oxygen for you. We learned that in lecture 2 already. But when given a choice between carbon monoxide and oxygen, the hemoglobin will always bind to the carbon monoxide instead. Okay, there is a higher affinity, higher attraction for carbon monoxide than it does for oxygen. And when it's bind to carbon monoxide, it's unable to deliver oxygen. So when you are exposed to carbon monoxide, you actually will feel tired, and you will feel a little bit nauseated, a little bit of a headache, okay? And that's why it's kind of dangerous. If you don't have a monoxide detector at home, what do you do when you feel a little bit tired, when you feel a little bit, you know, headache, right? Most of us would pop a pill, like Tylenol, whatever, and then go to bed, right? And that's how you might die in your sleep if the carbon monoxide continues to build up, right? Okay, so that's why we need a detector. And if the detector goes off, what you need to do is you need to open all the windows, okay? And then if it's your furnace, there's usually like an emergency number for you to call, right? For the company, and then they will come, you know, they'll tell you what to do, and they'll come fix it for you, right? Hopefully. All right, that is all. That is the end of lecture 4, and that is the cutoff for the first test. Okay, it will just be lecture 2, 3, 4. The lab quiz, however, the 2.5% one, that will include the cardiovascular system as well. Okay, so on Monday, I will take up the test review. I am not sure if I post that up yet. Does anybody know? Any of you have seen that? Maybe just give me a second.
Will you extend the time for the lab?
Will I extend the time for the? No, the lab is what lab? The lab quiz?
Excuse me, sir, the lab quiz, is this something we can do and then go back to it? Or we just have
No,
to do it one?
you just have to do it in one sitting, but it's a lot of time. I think it's only 20 questions, but you have like hour and a half to do it. Okay.
Okay.
And then again, you have 2 attempts, right? 2 attempts. So I cannot take. I don't think I can take up the lab online lab with you. Okay. I have the answers though. I can post it, but I really want you guys to do it first. Okay. So why don't you do it, and then I'll post the answer later on for you to compare. Okay. What I want to do on Monday is to do test review. Oh, it's not visible yet. Okay, so there it is. I just turned it on. I'll post a link later on as well, when the video is available. So this is the test review. And again, please try it out. Please try it out. Okay, and I will take this up with you guys on Monday. That's probably going to take the whole class. Okay, and then the test is going to be on Wednesday. Okay, no class next Wednesday. You just study and do the quiz, do the test, and then that would be it. Okay. If for those of you, some of you who are like really ahead of the course, the lectures for Unit 2 are available as well. Okay, so if you want to print them ahead of time or whatever, they're there. Okay, thanks. Take it
Professor,
easy. Sure, go ahead. Yeah.
Can we still do the part B of the draft question in the exercise?
Oh, like this one here, the
Yes.
emphysema one.
Yes.
Oh yeah, sure. So for someone who suffers from emphysema, right, what happens to their RV? So as I was saying in the PowerPoint, their residual volume is going to increase, right? Because they have all these big pockets, all these empty space, right, in the lungs. So you will increase amount of dead air, and the person will have a reduced gas exchange efficiency, shortness of breath, right? They
But the
feel
TD volume will remain the same because there's a big difference between residual volume and the TD volume.
the what will remain the same. I'm sorry.
TV.
TV, yeah, that's right. You will still be breathing, but then you're not going to be able to breathe. Like the air that's coming in is going to be mixed with more of those carbon dioxide filled air, right? And that's why you're not getting as much oxygen into your system.
Okay.
Okay, and exhalation becomes laborious. Okay? You actually have to use energy, like force the air out of your system like that. Okay.
Okay, got it. Thank you, Professor.
No worries.
One more last thing, Professor.
Sure.
I have some challenges remembering the terms. Is there like any
Which terms? Like all the
medical terms? Yeah.
Yeah, I don't know how you guys study in general for anatomy and even biology. Personally for me, I found reading the notes is not sufficient. So I tend to write things out a lot, okay? And one of the things that really worked for me was that I sit down with a blank piece of paper and then I just start writing various concepts that comes to my mind, okay? So for example, I will write down blood type. Okay. And then I'll be like, okay, let's talk about the genotype. Okay. And then, okay, IA, IB. And I would just fill up the whole page with as much information as I can remember. And then I would go back and compare it to my notes and see what I have missed. Okay. And then for the things that I don't remember, or for the terms and names, definition that I don't remember, I would add it on later on with like a different color. Okay. So like maybe you forgot about the sensitization, whatever. It's not letting me choose a different color, but you understand, right? I would add it in with a different color. And then I would start again the next day. And hopefully there will be less and less stuff that I forget to add on, in future iterations, right? So that strategy really helped me remember some of the stuff. Try it out, right? If that works for you. Or you can use the what do you call those things? Like the cue cards, right? Definition on one side and vocabularies on the other, right?
Yeah. Thank you, Professor.
Yeah. Okay. Don't forget there is the tutor that's available. I'll post some information if you want to contact him, and you can also contact me if you need extra help. Okay. Bye for real. See you guys next time.